Can you guys touch? This is a party trick.
I can do it.
Yeah? Okay. Can you touch going the other way?
Oh, that's horrible.
No.
Where's that towel?
Yeah? So, that does everything, right? Flexion, abduction, internal, external, extension, adduction. So right there, that's a nice quick screen. Now, if someone just had shoulder surgery, are we going to go, okay, let me see you do this? No, we're not going to do that, right? But in your patient who's coming in, you know, my shoulder kind of bothers me, I get pain with overhead activities, quick screen, we can find out kind of where they're at, yeah? Go ahead and lie down on your back. So we're going to measure shoulder flexion to start. Always make sure your patient's comfortable. Patients tend to guard shoulders a lot because they're very painful, so you need them to be as comfortable as possible. First of all, scoot towards me. And I usually just stand here as I have them scoot because basically when they hit me, I know they're in the right spot, and then they don't feel like I'm going to have them fall off the edge. Let's go ahead and give you a bolster. There we go. Is that one too high? Are you okay there? So that the shoulder has motion to move as you come overhead, go ahead and lift your head just a minute. There you go, come back down. So I kind of clear room for their arm to come through as we measure that motion. Going up. What are our landmarks here? So acromion process, right? Middle of the lateral acromion process. What else? In line with humerus towards. Which epicondyl? Humeral, that's good. Yeah, lateral. Lateral epicondyle. So, before you even get started, figure out which is lateral, which is medial. Because you know what happens when they're here, you're like, lateral, no problem. They get up over here and you're like, oh, you know, and then you're kind of like, where does that lateral one go?
Disappear.
So, you know, kind of get your bearings. So this is lateral. When she comes up this way, lateral is actually way down here. So that's where I want to be lined up. Also, another evil thing happens. You're like, oh, acromion process. This is totally unlike the hip, which the greater trochanter is just there the whole time. This, you're like, oh, okay, right here. But then, what happens when we get, oh my gosh, it's gone. Where'd it go?
Dang it.
Right? So you kind of have to know, okay, it's right there. And when I bring this up, it kind of stays right there. Because I can't go in and palpate it anymore. You just kind of have to know where it is. So get your bearings ahead of time, figure out where everything is. Plus, when her arm's down here, her trunk is nice and vertical. When I start forcing her into more flexion for passive range of motion, patients will start to arch up. So my nice vertical line here, go ahead and kind of arch up a little bit. So now I have to follow that arch to correct for the compensation that she's doing. So make sure that you're not necessarily going to have your stationary arm stay parallel to the table. You have to follow where midline of thorax goes to. Okay? Make sense? Yeah. All right. So we get lined up. Also, you'll see this isn't one that you can paste up against them. You're just kind of lining up and following. So go ahead and you're going to have the hand palm facing you. Bring your arm up overhead as far as you can possibly go. And so we got a lateral acromion process. She's arching a little bit, so we're going to follow that arch. We want lateral epicondyle. So we're going to stay there. So she has, come down eye level, she has about 162 degrees. And then go ahead and bring your arm back down. So that was 162 degrees active motion, right? Mm-hmm. Passive. So here, I usually ask, is it okay if I rest this on you? Because with a shoulder patient, for passive, they're typically in a lot of pain. They're going to be guarding, so you have to have very good handling skills. You can't just grab their arm and go, okay, be here. I'm just going to let go of you here, and I'm going to measure because they'll start to freak out on you. So you want to start, relax. There you go. See, she already doesn't want to relax, and she doesn't even have an injury. So you want to start good handling skills here, and then as I bring her up, my hand positioning changes, and I usually come under this way, because now I have complete control of her arm. She's completely relaxed on top of me. I have this hand here because now I can actually use this to pull down and get more pressure. Because a lot of your shoulder patients are going to be stuck here. So now by gripping here, I can actually start pulling them into a little bit more flexion, but they feel nice and secure at the same time. If it's a really heavy arm that maybe I don't have a lot of strength to hold very long, I like this position because then I could just clamp her into my side. So now I'm not having to lift her as much. I'm just kind of locking her in, and then I can use my body in order to create the force. So work on that handling today. So for her, what gets difficult here is I've got to be able to hold this, but I've got to be able to see what's going on over here at the same time, right? So if I bring her down more, we got to know where epicondyle is, right? So I've got to follow that. I've got to stay aligned there. My table's in the way. I can push down a little bit lower here, lower here, lower here.
You can only get up to 180, yeah?
Yeah. So now we have probably about, what, 173?
Yeah.
But we could ease them back out of it. And you can bring them back down. Yeah? Is that okay?
Oh, yeah, that's fine. So 180 is normal? How do you, I mean, I felt like I was pretty much...
Right, but what's happening?
Arching.
Yeah. Any questions on flexion? Active, passive? Okay, so let's go ahead and have our patient turn over onto her tummy. And we're going to measure her extension range of motion. So we're going to put this underneath the tummy. There you go. Come all the way to the end so you're nice and close to me. There you go. Go ahead and lift your feet up. There you go. Rest them down. There we go. Nice and comfy there? Okay. We don't want this to be in the way, so I might have her come up just a little bit. I'm just going to scooch you out over. There you go. Perfect. Okay. Active range of motion. So the motion you're going to do, you're going to lift that hand up towards the ceiling. Exactly. Okay. What are my landmarks here?
To go to deflection, the compensation is the
The arching the back is the compensation. Oh, thank you. So the arching the back is a compensation. Also, what people will tend to do, instead of staying here, they'll start to cheat out this way. So you got to kick them back in towards their ear. If they can't get that far, then you got to bring them down to where they can get back in that sagittal plane. As soon as they veer out of sagittal plane, they're done. Yeah. So, chromium process again. Right, lateral, mid-thorax, and which epicondyle? Lateral, which in case you've forgotten is on the thumb side, right?
Yeah.
Okay, so go ahead and raise that arm up towards the ceiling as far as you can. Thumb side. And look, she's lifting her acromion, so we have to compensate for that, right? There's that guy there. We're aligned with thorax. So she is at 46 degrees. Press back down. So that would be her active extension range of motion. So,
Keep your hand.
and palm has to stay facing the body. Yep. So now if we're going to do passive, so it's kind of that same thing, where I need to really support the arm. Got to be here. But then look what's happening. Do you see how her scap starts shifting? So I've got to adjust for that, and I want to kind of watch. And I can cue her, try to keep that scapula down if you can. How you doing there? Are we still okay? We're still in frontal plane, sagittal plane. So landmark is right there. How's thorax alignment?
Good.
Good.
And you can bend.
How are you doing? You're not going to pop out on me, are you?
I don't think so. Shall we, am I?
She's actually at about 80 degrees. So she actually has a ton of extension.
And you need to do jujitsu.
Yeah.
So you can bend the elbow.
Mhm. Questions? All right, why don't you guys go ahead and start this too?